Hi everyone, hope everyone has a good day today. So let me introduce myself. My name is HUMAIRA, yours MC for today. Today we have an interesting topic for you, which is pneumonia in the elderly. So let us go over the highlights of our discussion today. Okay, today's discussion will include the introduction of pneumonia, scientific studies on this disease, and we're going to have a session with our dietitian to discuss more about the strategies on ways of improving the nutritional problems. Today we will discuss a condition that is prevalent in our country, Malaysia. So before we go any further with our dietitian, SYAQIRAH, allow me to brief to you regarding on pneumonia first. Have you ever heard of pneumonia? Okay, pneumonia is a dangerous disease that affects your lungs and usually makes the breathing becomes difficult. So how does it damage your lungs? Okay, when a healthy individual breathes, the lungs, which is made up of small sacs called alveoli, usually fill with air. But when a person gets pneumonia, the tiny sacs become clogged with pus and fluid, and making the breathing become difficult and limiting oxygen intake to your body. Do you know there are three categories of pneumonia that typically affect people? The first is community-acquired pneumonia, which is called as CAP, which is the third most common in elderly and may usually be contracted outside the hospital. People aged 65 and above are more likely to be hospitalized as a result of CAP. Second, we have a healthcare-associated pneumonia, or we call as a HAP. So this HAP can occur during the hospitalization. The elderly who have been in the hospital for a long period of time are at higher risk for getting this pneumonia. So the third type of pneumonia is known as a aspiration pneumonia, and it is caused by the inhalation of things into a lungs as a result of a lung infection, such as food, saliva, fluids, or vomit. So this pneumonia is more likely to affect older people, especially those who have swallowing difficulty. Surprisingly, in 2020, the prevalence of pneumonia across all ages in Malaysia was 11.2% in rural regions and 11.3% in urban areas, which is making pneumonia the second leading cause of mortality, with CAP is 4.2% and HAP is 25.55% in Malaysia. Okay, pneumonia was diagnosed in a large proportion of hospitalized patients in Philippines, which is 19.9%, and a moderate proportion in Malaysia, which is 6.4%, but was diagnosed in a relatively low proportion in Indonesia with 1.5%. Now, who is at risk for getting this pneumonia disease? Pneumonia is more common in elderly persons with asthma, people who have lost their ability to eat, people who have bad oral health, people who are bedridden, and those who have lost their appetite. So if you have a pneumonia, you might not be willing to eat, usually coughing with a mucus, and have a nausea and vomiting, having a chest pain during coughing, have a difficulty in breathing, and have a fever, and sometimes might be confused and have a headache. Now let us discuss how to manage this pneumonia disease with our dietitian SYAQIRAH.
Thank you, Ms. HUMAIRA. According to a few studies have reported a relationship between muscles and pneumonia in older people. The sarcopenia is a risk factor for pneumonia in older people, and aspiration pneumonia in patients with low muscle mass show high mortality rates. Past study also show malnutrition was common and associated with a poor long-term outcome in patients with community-acquired pneumonia, particularly the elderly. As a result, we can see that this condition is very important to be concerned about and to avoid it from affecting our senior citizens. Now let us discuss how to manage this disease. Okay, let's start off on how to encourage the food-first approach among elderly. The most crucial steps to prevent the nutrition problems are to ensure that they consume adequate nutrient intake in their daily life. Hence, it's vital for us to motivate them to eat frequently, but in a small quantity every time. For example, they can have 3 small meals in addition to another 2 or 3 nourishing snacks in between the meals. The snack may include high-energy snacks such as crackers, biscuits, and cakes. Apart from that, food fortification that can enrich their daily diet with energy and protein, like spread butter and honey or jam on toast, drizzle olive oils on salads, along with vegetables dishes also should be included to boost their energy and protein intake. Okay, so the second point is to prevent the dehydration among patients. This because adequate fluid intake is crucial to replace the fluid loss due to the fever or rapid breathing, treat dehydration and reduce the viscosity of mucus. Thus, appropriate education and attention to the hydration should be implemented to them to improve their quality of life, reduce hospitalizations and the economic burden related to hydration, associated morbidity and mortality. Speaking of pneumonia, dysphagia or swallowing difficulties is very common among them, which then will lead to the loss of appetite. That's why to tackle this problem, it's important to give extra attention to the texture of the food. Patients with pneumonia is advised to consume soft and small by chopping or mincing the food to ease the during eating. Besides, it's also suggested for the patient to sit upright and consume thickened liquid in order to minimize the risk of aspiration. Last but not least, patients with pneumonia tend to feel that all foods taste sour, sweet, bitter or metallic. Adding flavor from herbs and spices to season the food and practice a proper oral hygiene may help them to reduce dysgeusia. I think that's all from me today, and I'll pass it to the host of the day, Miss HUMAIRA. Thank you.
Thank you, Miss SYAQIRAH. It was very interesting to hear what you had to say today. So now that the conference is over, we can see that controlling lifestyle risk factor like smoking can cut down on the number of people who are getting pneumonia, especially in the elderly. So it is important for us to take a good care of our health so that we can keep our health and avoid getting serious disease. So alright, thank you to everyone who came to our session today.